Hi everyone, this video is all about how to treat prominent ears, basically ears that stick out. Now this is something that is treated quite commonly in younger children. By the age of 7, the ear has undergone about 70% of its growth. By the age of 9, about 90% of its growth. And because of that, some plastic surgeons advocate for children ages around 7 to 9 years old to consider having their prominent ears treated. I'm not a huge fan of that. It is still a cosmetic procedure overall. And for me, I don't tend to do children with this, but I do see adults that come in fairly regularly who have prominent ears and want them set back. So this is for ears that stick out, and the surgery itself, and this is only really treated surgically, is done by literally pinning the ears back. So let's start by showing you exactly why some people develop prominent ears. There are two main causes of prominent ears. And the first cause is when you miss the antihelical fold. And what that is a fold on the top of the ear, and I'm going to get a little close here, a fold on the top of the ear that we don't have. And when it doesn't fold over like that, it causes the ear to stick out. Okay, so there are these creases on the top of your ear, and these creases are made to basically shape your ear, and so that your ear basically folds back. And if that crease is not there, then it can cause the ear then to stick out. And this can happen on one side or both sides, depending on how you've developed. So that's one way that ears become prominent. The other way that ears become prominent is overgrowth of your conchal bowl. And what that is that's the round bowl here in the ear, okay, and that's the part that's really at the base of the ear that leads into your ear canal. It's this round we call the conchal bowl, and when that conchal bowl overgrows and becomes too large, then it can cause the ear then to rotate out because it's too big. Okay, so those are the two main causes of prominent ears. Lack of the antihelical fold, which is a fold at the top of the ear up here, causing then the ear not to fold back and for it to stick out. And then overgrowth of that conchal bowl, which is the bowl, the kind of round area at the base of the ear that leads to your ear canal. When that overgrows, basically it grows and pushes the ear out. So most people who have prominent ears have a combination of both things going on. It's not just that they're missing the fold, it's not just that their conchal bowl is too big, but usually it's both. So the vast majority of times when we perform otoplasty or the ear pinback procedure, we do both things. We treat the fold, and we also reduce the conchal bowl. So how does the surgery work? Well, the surgery basically is done under a general anesthetic, so you're completely asleep. While you're asleep, I start with one ear and I make an incision behind that ear, once again while you're asleep. Then I dissect over the ear to where that fold is, and I recreate that fold using permanent sutures. Okay, so there's technically two things that we do. I use a special instrument to literally scrape the surface of the cartilage to cause, and by doing that, it causes a cartilage that may be straight to kind of curl. Okay, so we what we call scrape or scratch that cartilage to cause a cartilage to curl. But usually that's not enough to create that fold that we need. And so what I put in some permanent sutures as well to create that fold. The second step is removing the excess conchal bowl. So through that incision on the back of the ear, I remove the excess cartilage and set that bowl back. And by putting sutures from the conchal bowl, that round area, back to the back kind of your neck, then we can actually then set that conchal bowl back. So it's those two steps. The first step is creation of that missing fold using permanent sutures, as well as doing some cartilage scraping with a very specialized device. We combine that with literally excising or cutting out the excess cartilage at the base of the ear, and then suturing that cartilage, that base of the ear, back using permanent sutures. Once that is done, typically I will put a tiny little drain in that area, and then we suture everything shut. We go then on to the second side and do the same thing. The surgery itself, total length of time is probably about 2.5 up to 3 hours. It's a general anesthetic, so you're completely asleep, and when you wake up, there's a tiny little drain behind each ear, okay? But you also have a pretty big head wrap that we wrap around your head. Because what we want is we want to put compression on the ears. One of the big complications that we want to avoid with this, and the reason why you wear this kind of big head wrap overnight, is we want to avoid a blood collection. If you've ever seen a wrestler with cauliflower ears, that's what we want to avoid. And what can happen is if you get blood around the cartilage of the ear, and that blood is not evacuated or removed, it can create scarring, which can cause the ear to look like a cauliflower ear, and we definitely don't want that. So to avoid that, once again, I use a little drain to drain out any extra blood that can develop in that area, and we use a nice kind of a firm wrap over the head to provide some compression as well. After surgery, you're in the recovery room for about a half hour to an hour, and then you head home. You want to sleep with your head elevated. It's not a real painful surgery. You may take a few pain pills, but that's probably about it if you take any. You come back to see me either 1 to 2 days later, and at that point we take the head wrap off, take a look at the ears, and take those drains out and make sure everything looks good. Everything looks good, then what we usually have you do is wear just a headband over that area. And you can use just a regular headband like a sweatband or something like that, because what we want to do is keep those ears pushed back, and we want to avoid any tendency, let's say while you're sleeping, for the ear to be pulled out. And God forbid you don't want your great aunt to be grabbing your ear and scolding you and pulling it out and trying to snap those sutures. And so we want it to heal in a fashion where it's obviously sticking back. And so typically you wear a headband 24 hours a day for about 1 to 2 weeks, and then you wear the headband at night for as long as a month or two. Once again, not a real painful surgery. What are the risks of the operation? Well, we talked about the cauliflower ear. Very unusual for something like that to happen, extremely unusual, but that may be one of the worst potential complications. Infection is a big thing that we worry about as well. If the cartilage gets infected, that could be a big deal and could even potentially be deforming to the ear. So because of that, we watch it very closely for any signs of infection and treat it very aggressively if that happens. There are risks of scarring. You're going to have the scar on the back of each ear. That's usually not very visible because way in the crease behind the ear. If we remove some of the conchal bowl, some of that cartilage, sometimes you can get a little bit of irregularity of the cartilage at the front of the ear that you might be able to see if you look closely. Same thing with the crease up here in that new fold. Sometimes there may be a little irregularity there that you might see as well. Other risks of the procedure is you could potentially have those sutures snap and the ear could come back out. That's always possible. It's not very likely. Most people find that it heals just fine. There are also risks of asymmetry. You may find that one ear sticks out a touch more than the other afterwards. It's not going to be perfect. I do the best I can to try to create the best result we can, but once again, it can never be perfect. One thing that's interesting too is that typically people who have prominent ears, the ears really stick out, they don't necessarily, in general, I find, want the ears to go back to a normal position. They typically want them literally plastered to the side of their head. So for some reason, when people have prominent ears, they really want to set it back. They don't necessarily, in general, want it to where the average measurements are made and are. That is something that we can talk about prior to surgery if you decide that you want to do an otoplasty, and we can go over the details of exactly how that will work. But I do tend, in my own practice, to try to set back a little more than what the kind of the quote-unquote normal measurements of how far the ear should project from the skull should be, just because that's what patients seem to want. Now, should you decide to have surgery, we can talk more about the risks at the pre-operative appointment as well as during your face-to-face consultation. But these are some of the main things that we are concerned about. Now, you can see a before and after photo there of a young woman who I set her ears back with a really nice result. This is a young man. We did the same thing. And once again, his ears weren't terrible. I'll show you from the back. He grew out his hair fairly long to try to cover them, but setting them back really did help with him and his self-image. So as you can see, they weren't terrible before, but now we got them back to what would be considered a very quote-unquote normal distance from his head. And this is a woman who had one side basically that stuck out, and you can see on her left side that left ear sticking out. setting it back once again with a very nice symmetric result. So prominent ears are very common. You don't have to have it done. We had a president that just left office recently who had pretty prominent ears, and he never had them done. But if they bother you, it is a surgery. The surgery does take a bit of time. There are small risks with the operation, but it does work very, very well. And I think for a lot of people can make a real big difference in how they see themselves. Thank you for watching this video on prominent ears.